Okay, I'm glad you're here. Ralph Havens, physical therapist, Beyond Limits Physical Therapy in Fairhaven, in Bellingham, Washington. And I'm going to show you the things we did to help runners solve chronic and mysterious conditions, things that were not being helped with successful surgeries, that yet the person still wasn't able to run, with all sorts of strengthening and stretching and the right kind of rest and kinesio tape and strapping and all these things done by very qualified, very good, skilled physical therapists, chiropractors, massage therapists, others. And the key is we need to find what's actually the root cause. Of course, what's the cause of this thing? And there's a very particular principle that we have in integrative manual therapy, the physical therapy that I practice, and it's that the body, your body, is protecting yourself from something. And it's very smart. Your body's very smart. I'm going to break down a few different examples and show you videos of runners and before and after session, because I'm at the interface between rehab, finding and fixing up these chronic conditions, and performance optimization. I have runners that I see on a regular basis to help them improve their running stride length and their power, and improve their stride frequency and get better performance out of them. It's what I do with my son, who's a fast little guy, and it's what I do with others. So check out this next section. We're going to be going deep into how to find the root cause of chronic and mysterious conditions, especially running conditions, and to improve performance. All right, you guys, Ralph Havens here, Beyond Limits Physical Therapy. So running injuries, knee pain that's not resolving even with a quality surgery. All right, you guys, Ralph, and I'm going to be showing you some examples of what we found over the years that has helped runners heal. I've got some examples of knee pain, one with a guy that was out for a year, over a year, runner, coach, young guy, and was unable to run for over a year. And he had had surgery, successful surgery according to the doctor. He had had lots of time off. He was very, very strong, very good with his exercises, his strengthening, his rehab, yet he couldn't run. And we solved it. I saw him one time, saw the root cause, which is the most important part, finding the primary root cause. I gave him some information and he went for it. He did it. And a week later, he was back to jogging a little bit, and then jogging a little bit more. And then he got all of his running back. Interestingly enough, lymph nodes that were chronically swollen also went away. And he said that he was no longer getting sick. He was no longer getting infections like he used to get. And he was back to running. So that's one guy. I'm going to give you a few examples and tell you how we did this and how you can do this if you're dealing with a chronic running injury. And this was a guy that had had a successful knee surgery and it didn't work. And then it did work once we got to the root causes. Some other athletes, I won't give very much identifying information to keep it private, but student athletes, runners that were out for entire seasons, some for over a year, and unable to run. One with a hip pain that was limiting them, couldn't run more than a minute. Knee pain that was resisting all treatment, all rest, all strengthening, just couldn't get back to running. And both of those resolved. And again, it was finding the root cause, solving it with manual therapy techniques, things that we do, things that I do, and giving very specific, detailed information about how to change things in lifestyle that can resolve the primary root cause. So in those two cases, they did what I asked them to do. They came back a week later, and the person with hip pain no longer had hip pain and was back to jogging. And over the course of a few weeks, was back to jogging more and then doing some repetition intervals, and even got to run a few races at the end of the season. The other runner was did what I asked them to do and was better the second week, was a little better after that, and got some running back in his body, did some strides and some repetition running towards the end, ran some races and actually ran a PR. And he told me he couldn't have done it without me. He had been through lots of rest, lots of strengthening, lots of trying to fix it up. He loved running, but he couldn't run. The primary thing was to find the root cause. I'll give you two more examples and then tell you how to do this. if you like. So had a runner who also very good runner, student athlete runner, couldn't run for over a year. His stride was getting shorter and shorter. He had beautiful stride, but it wasn't what it looked like, used to look like when he was a kid. I saw a video of him when he was a kid, and you know, a middle schooler, but now he was past all that, much farther along in his academics, and he couldn't run. His coach was even advising him to just quit. He said, "I can't help you. You can't train." We found the root cause. We worked on it. His was a groin issue and hip, groin, and lower abdominal issue. We solved that, and he did the recommended things, and he got his running back. Actually, got a PR that season, at the end of the season, in his signature event. So on the track. So, and then one more is me personally. Years ago, I'm a physical therapist. I was a physical therapist in San Diego, had a clinic, Mission Hills Physical Therapy, 5 therapists working for me, running 70, 80, sometimes 90 miles or more a week. And was 228 marathoner. I was looking forward to running into my 40s and competing at that level. But then I was shut down, couldn't run, had a calf spasm that wouldn't go away. I had all my therapists work on me, or some of them therapists work on me. I went to classes. I got treatment from other people. I got 3 different pairs of orthotics, and nothing worked. And I finally went to a therapist in Los Angeles who did what I now do, integrative manual therapy. And she found that the problem was in my chest, actually in the vessels of my chest, the vessels going into the heart, going out of the heart, the aorta. And sounds kind of crazy, but my body in its wisdom was protecting my aorta and my heart, smart body. And the result was it was spasming muscles in my leg. So all that work on the leg muscles, that wasn't where the problem was. But by finding the primary root cause for me, which was up here, we were able to solve it. So now that's what I do. I have a technique, a process called myofascial mapping, and we can find what's the cause. Of course, you want to find the cause of it, because what you're dealing with, if it's not going away, like a hip or a knee or a calf spasm or Achilles or a groin issue, if it's not going away, if you're doing all the right things, you're resting it, you've got the right dosage of training, you're getting a high quality physical therapy, strengthening, stretching, all the coordination drills. If it's not going away, you're probably looking in the wrong place. Kind of like me trying to fix a calf. The calf wasn't the problem. It was a totally normal calf. It was spasming to protect something up here. So in the case of those other runners, there was stuff in the pelvis. And we're talking about not joints and muscles. They did have joints and muscles that were problematic, but they were protecting some visceral structures, which is organs and other arteries and veins. And so finding the actual cause, and there's techniques to do in integrative manual therapy to heal it up, to fix it up, they were able to run again. And then changing a couple of things in their lifestyle, very, very important. Some of the nutrition pieces, very specific, and you can get your running back. So if you're chasing symptoms, if you're chasing problems, if you can't quite find how to get well, reach out to me, 360-599-2217. I'm right here in Fairhaven in Bellingham, Washington. And I can even talk to you over Zoom if you're far away. And we can find what's going on for you and help you find your root cause and get you on the track, back on the track and back on the trails and doing what you love, which is running. So I'm going to show you some things now of some before and after examples, because when I'm the interface between rehab, which is what we just talked about, healing the physical body, and performance, optimizing the stride frequency, the stride length, the power, optimizing that, optimizing performance. And for my boy, I'm going to show you a video of him running. We've optimized his stride. He's got a beautiful stride. People talk about how it looks like he's just got this big stride that's like spinning, because he is. So I'll show you how the result of what can happen. And I'm going to show you pre and post running of one of our athletes who, different than the ones we just talked about, who had a left hip problem, and what her result was before and after. So let me get this all ready for us, and bear with me here. I'm going to show you first. I hope this works. I'm going to show you first the clinic, Ralph Havens physical therapy, Beyond Limits Physical Therapy in Bellingham, Washington, 1134 10th Street, right by the Village Green. We do treat chronic pain, running and sports injuries, and autoimmune conditions, because a lot of times those are linked. So I'm going to show you, let's go straight to Ben's running form, and you can watch. Let me turn this all down. So look at that stride. He's the second guy there. The first guy was pacing him through a 5:24 mile as almost a sixth grader. So how do you do that with your stride? And then let's get another one. Let's see, where are we here? I thought I had another one. Well, let me get before and after of Hannah. So this is Hannah, and she had a 2-hour session optimizing her performance. She had a tight left hip, but I'm going to show you the before. And so she looks like a pretty good runner, right? But notice how she's going up and down, and she's landing on her foot, and her ponytail is going to the left, but not to the right as much. That's because she's rotating a little bit more to the right. She's not rotating to the left because of that tight left hip. Okay, so there's that. And then here is afterwards. Oh, you're done? So here she is after. Here she is afterwards. Let's rewind that. I thought we could rewind that. Let me go back here. So this is her afterwards. And look at that stride. See how she's pawing back with her legs now. She's cycling more. Her ponytail is going both to the right and the left. Much more power out of that stride. And what we did was we did a 2-hour session to optimize her performance, help her left hip. And that's what the result is. So let me see if I can find one more video for us. This is one more of Ben, so you guys can see what optimized form looks like. This has been winning one of his cross-country races. So I work on Ben 3 or 4 times a week. We're all about optimizing performance and staying out of injuries. There's much more that we do. You can find us on the blog, ralphhavens.com/blog, and I go into some of the training that we use. But what I'm talking about today is how to get over running injuries. If you're not getting well, if you're dealing with something that's just stopping you from running or stopping you from running the way you want to run, reach out to me, ralphhavens.com, 360-599-2217. I'm in Fairhaven, Washington, Bellingham, Washington, the corner of 10th and Mill Street, right by the South Bay Trail, and our favorite running store, Fairhaven Runners. So reach out to me, and we'll get you back on track. All right, you guys, I will talk to you all very soon. Let me just end.